Wake County's lead program works to ensure that child-occupied facilities and residents are tested after a child tests positive for lead poisoning. Joining now are Christy, Klaus from Wake County Environmental Services and Lynn Ledford, our Community Health Director. Thank you, ladies, for being with us.
You're welcome.
Thank you for having us.
Christy, let's start by talking about lead itself. What is lead?
Lead is a heavy metal that is soft and very malleable. They use it a lot in manufacturing. They use it for lead-based paint that's prior to 1978. They use it to help the paint dry quickly, and also it is a good mold and mildew retardant. They used it on exterior of buildings and homes and residences. It's very durable and lasts a long time.
How dangerous can lead be if a child is exposed and it goes undetected?
It can be a significant issue if it is not detected, because it can impact several of the organs in the brain. And fortunately, this is a very preventable issue for us, for children with exposure to lead. But it can be significant, and high levels can cause several problems if they're there long term.
What are the sources that you all see the most frequently?
We find lead most common, in paint in older homes before 78, especially in friction impact areas around doors and window frames where there's appealing chipping paint. We also find, though, lead in spices and herbs that are grown in contaminated soils. I have several spices that we have found to be high for lead in people's homes. This turmeric is a root that grows in the ground, and this was found to be 890 parts per million for lead. We also find lead in your vinyl mini blinds prior to 1997 in older homes. What happens is the sun breaks down those vinyl mini blinds, and the child goes over to that windowsill and touches that windowsill, looks out the windowsill, or even chews on vinyl mini blinds.
And Lynn, there's some other sources inside the homes that people need to be aware of as well. You had some information about those?
Sometimes parents unknowingly, because of their work environment, can bring in lead sources into the home also. Perhaps they work somewhere where they work with engines and transmissions and things of that nature, and some of those areas can actually then have dust on their clothing. They can bring that in and unknowingly expose their children that way.
When a child has lead exposure, are there symptoms that we can actually see as parents, or what are some of the warning signs?
Most of the time you will not see any symptoms, or you will not attribute it to something like lead. But there are some symptoms if they have really elevated levels. They can be symptoms such as headache, vomiting, diarrhea, but those are also associated with a lot of other issues that children might encounter. So that's probably a question that you would need to work with your pediatrician, and you would need to probably request that they have the lab work that would detect whether or not they do have elevated lead.
What is the recommendation medically if parents have concerns about lead?
We have actually free testing that is done through the state lab up until a child is 6 years old. After that, there are some charges, but it's minimal. And we try to coordinate, of course, with the pediatricians in the area and in our clinics. They just need to be monitored for their blood levels, and then of course, there's some simple solutions. A normal, healthy diet for a child that has vegetables and calcium and the basic nutrients that they need is something that can also help significantly for children if there are risk of lead contamination. So we look at those kinds of recommendations that we give them. We also try to make sure that they're not inadvertently exposed to something maybe in someone else's home or their daycare or wherever they might be. So it may not only be the home that they live in that is a concern. They may need to look at those things also.
And Christy, you brought some other props, and what would you like to share with us about those?
Oh, also, I brought in, whenever you're doing any work in your own home, especially, or renovating an older building, you really need to cordon off those areas and use a certified type lead renovator. The Health Hazards Branch has a list of certified lead renovators on their website, but you should put signs on there warning this is a lead work area to keep children out of that area. You need to do good specialized cleaning techniques before and after the work is done.
Anything else you guys want to add?
You're going to always hear from me to wash hands, because if children are outside playing, whatever, touching things before they eat and consume, food or anything, snacks, whatever, they need to be washing hands. That's true for a lot of reasons, not only lead.
We really appreciate all the information about lead. It's an important program out there for especially those families with young children in them.